Okay, and when were you a physician but not have health insurance? How did
So
that work?
when I just finished actually my residency, and I was having to study for my boards, and I was having to wait for my paperwork to go through for my fellowship to start. So there was 4 months that I didn't have health insurance and couldn't afford it because I didn't have a job.
Okay, so you would have had to treat yourself, I guess.
Yeah,
So okay.
I would have had to treat myself, and I'm fortunate that I wasn't in an accident or that nothing really bad happened, because it would have been a bad situation.
Okay.
Mm-hmm.
And have you had any chronic ailments, things you've had to deal with health insurance in your life?
Um, I haven't really had anything. I mean, I've had some small injuries particularly when I was younger. I grew up in Canada, so it was a little bit less of an issue then.
Okay, you grew up in Canada. Okay,
Mm-hmm.
interesting. And what do you do now? I mean, can you tell us a little bit about your job now and what you do day to day? Yeah.
So now I am, as I said, I'm in fellowship in adolescent medicine, which basically means that I'm working as a physician in an adolescent clinic that's affiliated with Mt Sinai. And it's a really great clinic. I feel really privileged to work there. It is the largest adolescent clinic in the country, and it's also completely free. So any teen from the age of 10 to 22 years old can come there and get care that's completely free and confidential. So we see a really diverse patient population as a result of that. Some of it are patients that actually have insurance, but they prefer to come to us just because we're not their pediatrician that their mother comes to their visits with, so they can talk to us about different things. But then there's a large proportion of patients that also don't have health insurance. And the last patient that I can tell you about, which just happened late last week, was not an atypical patient. She was 19 years old, and she was first generation college student. So she had managed to get herself into college, and she was going to college part-time so that she can also work part-time in order to be able to pay the bills, because her family wasn't able to really provide her with some financial support for school. And I have a lot of patients like that who are doing school part-time and work part-time and are having to do it because of their financial situation. But you can't get health insurance if you're going to school part-time, and you can't get health insurance if you're going to work part-time either, and you often make too much money to be able to necessarily afford Medicaid. So it's really crazy when you have these incredibly hardworking young Americans who are the basis of our country in so many ways, and they're not able to get health insurance, and they're fortunate enough to be able to come to our clinic. At the same time, I wonder what's going to happen to them what happens when she gets to be 22 years old. She's probably going to be still in college potentially, and I don't know where she's going to be able to get her health care there. And right now she doesn't have a chronic condition that she has to go to the doctor for to get medicine or something like that, but she's also on birth control. She's trying to be responsible about that. She doesn't have health insurance. It's really, really expensive. So yeah, it's not a great situation.